Assalamu alaikum, everyone. Welcome to our language sensitivity series as part of the Educate to Illuminate initiative. Now, take a moment and think about how would you respond to someone who tells you they are struggling with the suicidal thoughts? Or how would you respond if they tell you they are suffering from anxiety? Or they cannot get out of bed? Now, does your immediate response to your Muslim sister sound something like, "This is haram, maybe you should pray more"? Or, "It's only in your head"? Or, "You're being tested, and a strong believer will overcome these challenges very easily"? If you think you would say any of what I just mentioned, that is okay. It's very common. And if we're being honest with ourselves, it can also be very uncomfortable when someone is being vulnerable with you, or it might catch you off guard. What is important is that you realize when someone might be reaching out to you for support and help, even if it's not immediately obvious. And you can help if you know what to look out for and know some things you can say or do for someone struggling. Keep in mind how knowing your response can help to stabilize a situation. But saying the wrong things might also cause someone to feel more guilt, stigma, and shame. So here are some signs of someone experiencing a mental health crisis. Change in appetite, such as they're overeating or undereating. You notice lack of personal care. You also notice behavioral change or mood swings. You notice increased desire to isolate socially. You notice they are starting to use substance or they are self-harming. You notice they are talking about suicide or having suicide ideation. Or you notice they're feeling very trapped or they don't see any way out. Only disclose to you they are losing faith in community. So if you notice any of these signs, here are some general tips to keep in mind when you're speaking to someone experiencing mental health crisis. Number one, avoid downplaying or minimizing any issue, even if it's not relevant to you or your experience. Speak very calmly and reassuringly. Also, it's very important to be present during the conversation and pay attention to nonverbal communication. Normalize silence and give them as much space and time as possible. Be very patient and give them time to speak and do not interrupt. It's also very important to listen compassionately and non-judgmentally. So you need to put your judgments aside, park them aside. Also offer support and suggestion, but do not push your opinions. Remember, there is adab when giving nasiha or advice. And ask how you can help them and what do they need. If the person is in immediate danger, help them getting the support needed, such as taking them to the hospital. There's a lot more to say on this topic, especially around what to do if we notice a crisis is escalating. For a more detailed explanation, check out the language sensitivity toolkit at nisahelpline.com. Thank you for watching. And in our next video, we will cover how to speak to a Muslim sister who's experiencing abuse. Assalamu alaikum wa rahmatullahi wa barakatuh.